right, so we talked about the upper respiratory system, and now we are going to talk about the lower respiratory system. And the lower respiratory system starts with the trachea, which is sometimes called the windpipe. This is a rigid tube about 12 centimeters long and about 2.5 centimeters in diameter. It is found anterior to the esophagus. It is supported by 16 to 20 C-shaped rings, and these rings are made of hyaline cartilage. They reinforce the trachea and keep it from collapsing when we inhale. There are openings in the rings, and they face posterior towards the esophagus. The inner lining of the trachea is ciliated pseudostratified columnar epithelium, and this tissue is composed mainly of mucus secreting cells, ciliated cells, and stem cells. And this is because all these mucus cells are the guys that come in and trap the inhaled particles, right? Your respiratory system, your trachea, is a mechanism for debris removal, and it does this because of these specialized cells that we find here. The beating of the cilia drives the mucus toward the pharynx, where it is then swallowed. You also have a middle tracheal layer, and this is connective tissue beneath the tracheal epithelium. This contains the lymphatic nodes, mucus and serous glands, and the tracheal cartilages. The adventitia is the outermost layer of the trachea, and this is a fibrous connective tissue that blends into the adventitia of the other organs of the mediastinum. You then have a right and left main bronchi. This is where the trachea actually forks at a level of sternal angle. So basically it kind of comes off into two branches. And the carina is the internal medial ridge in the lowermost tracheal cartilage. And this directs the airflow to the right and the left, right? Because you have two lungs, the right and the left. So this trachea then forms two bridges or branches then to the lungs. So it shoots off from the main one goes to the right, one goes to the left. You then have a lung. This is a conical organ with a broad concave base resting on our diaphragm. And it has a blunt peak called the apex, projecting slightly above the clavicle. You have a costal surface of the lung, and this is pressed against the rib cage. You also have a mediastinal surface, which faces medially toward the heart. The hilum is a slit through which the lung receives the main bronchus, blood vessels, lymphatics, and nerves. And all these structures constitute what's called the root of the lung. The lungs are very crowded by adjacent organs. They do not fill the entire rib cage, nor are they symmetrical. Your right lung is shorter than the left because the liver rises higher on the right side. The right lung has 3 lobes, the superior, middle, and inferior, and it is separated by a horizontal and oblique fissure. Your left lung is taller and narrower because the heart tilts towards the left and occupies more space on this side of the mediastinum. It also has an indentation, which is for the cardiac impression. The left lung only has 2 lobes, the superior and the inferior, and it is separated by a single oblique fissure. So the right lung has 3 lobes, the left lung has 2 lobes. The bronchial tree. This is a branching system of all the air tubes in each lung. From the main bronchus to about 65,000 terminal bronchioles. So you have a lot going on in your lungs, and it's sometimes referred to as a tree shape. You have the main or primary bronchi. This is supported by the C-shaped hyaline cartilage rings. Then you have a right main bronchus, and this is a branch about 2 to 3 centimeters long arising from the fork in the trachea. The right bronchus is slightly wider and more vertical than the left. Aspirated or inhaled foreign objects lodge in the right bronchus more often than in the left. And that is because it is slightly wider. You then have a left main bronchus, and that is about 5 centimeters long, and it is slightly narrower and more horizontal than the right. And again, this is just because of the way our body is set up. And this is because our body is not symmetrical when it comes to our organs. Okay, then we have what are called the lobar or the secondary bronchi. These are supported by crescent-shaped cartilage plates. You have 3 right lobar bronchi, the superior, middle, and inferior, 1 to each lobe of the right lung, and you have 2 left lobar bronchi, the superior and inferior, 1 to each lobe of the left lung. Then there are segmental or tertiary bronchi, and these are supported by crescent-shaped cartilage plates as well. There are 10 on the right, 8 on the left. And you have a bronchopulmonary segment, and this is functionally independent unit of the lung tissue. All bronchi are lined with ciliated, pseudostratified, columnar epithelium. Cells grow shorter and the epithelium thinner as we progress distally. The lamina propria has an abundance of mucus cells and lymphatic nodules, and these are positioned to intercept inhaled pathogens. Your respiratory system is very good at trapping things because of these ciliated pseudostratified columnar epithelium cells. These are the ones that are trying to bind with any kind of pathogen that might be getting into your trachea and into your lungs. We don't want that. So that's why these cells are here, and that is their job, is to trap anything that they don't think should be there. All divisions of the brachial tree have a large amount of elastic connective tissue, and this is because you have what's called recoil when you're breathing. Your lungs expand and then they recoil, depending on if you are inhaling or exhaling. There is also a mucosa, and this has a well-developed layer of smooth muscle. The muscularis mucosae contracts or relaxes to constrict or dilate the airway, regulating airflow. So this is what I basically just said. Depending on if you are inhaling or exhaling, you have a relaxation or a constriction versus a dilation. Pulmonary artery branches closely follow the bronchial tree on their way to the alveoli. So your arteries are kind of lining, going with all these tubes. The bronchial artery services the bronchial tree with systemic blood, and these arise from the aorta. Then you have bronchioles. These lack cartilage. They are 1 millimeter or less in diameter, so very small. There's what's called a pulmonary lobule. This is a portion of the lung ventilated by 1 bronchiole. They have ciliated cuboidal epithelium. They have well-developed smooth muscle. And they divide into 50 to 80 terminal bronchioles. And these are the final branches of the conducting division. They are very small, 0.5 millimeters or less in diameter. They have no mucus glands or goblet cells, but they do have cilia that move mucus draining, but they do have cilia that are able to move the mucus that's draining into them back by the mucociliary escalator. Each terminal bronchiole gives off 2 or more smaller respiratory bronchioles. Your respiratory bronchioles have alveoli budding from their walls. This is considered the beginning of the respiratory division since the alveoli participate in gas exchange. They divide into 2 to 10 alveolar ducts. And they end in alveolar sacs, which are grape-like clusters of alveoli arrayed around a central space called the atrium. So the alveoli, this is where the gas exchange is actually taking place. There are 150 million alveoli in each lung, and they provide about 70 meters squared of surface area for gas exchange. Their cells are squamous type 1 alveolar cells, and these are thin, broad cells that allow for rapid gas diffusion between the alveolus and the bloodstream. And they cover about 95% of the alveolus surface area. So they are not the only type of cell, but they are the most prevalent, comprising 95% of the cells, because the main job is to exchange that oxygen and carbon dioxide. You also have great alveolar cells, which are type 2 cells. They are round to cuboidal cells that cover the remaining 5% of the alveolar surface. They repair the alveolar epithelium when the squamous cells are damaged. They also secrete pulmonary surfactant. This is a mixture of phospholipids and proteins that coats the alveoli and prevents them from collapsing during exhalation. There are also alveolar macrophages, dust cells, and they are the most numerous of all cells in the lung. They wander the lumen and the connective tissue between the alveoli. They keep the alveoli free from debris by phagocytizing dust particles. 100 million dust cells perish each day as they ride up the mucociliary escalator to be swallowed and digested with their load of debris. Each alveolus is surrounded by a basket of blood capillaries supplied by the pulmonary artery. The respiratory membrane is the barrier between the alveolar air and blood. The respiratory membrane consists of squamous alveolar cells, endothelial cells of blood capillaries, and their shared basement membrane. The alveoli play an important role in preventing fluid from accumulating in the alveoli. It's important to prevent fluid from accumulating in the alveoli. And this can happen if the gases are diffusing too slowly through the liquid. And then it slows down the process. So alveoli are kept dry by absorption of excess liquid by blood capillaries. Lungs have a more extensive lymphatic drainage than any other organ in the body, and that again aids in making sure that there is not an accumulation of fluid. Low capillary blood pressure also prevents the rupture of the delicate respiratory membrane. So a couple things are working together to make sure that these gases are diffusing at the correct rate and that we don't have an accumulation of fluid in our alveoli. The pleurae. Well, this are all the different membranes that deal with the lungs. You have a visceral pleura. This is a serous membrane that covers the lungs. You have a parietal pleura. This adheres to the mediastinum, the inner surface of the rib cage, and the superior surface of the diaphragm. And then you have the pleural cavity. This is a potential space between the pleurae. Normally there is no room between the membranes, but it contains a film of slippery pleural fluid. Why do we want this fluid? Well, because it reduces friction. It also creates a pressure gradient. The lower pressure than the atmospheric pressure, which assists in lung inflation for when we're breathing. There is also a compartmentalization, which prevents spread of infection from one organ in the mediastinum to other organs. And that brings us to the end of the lecture for the lower respiratory system. We just went from the trachea all the way down into the lungs, into the alveoli. I hope you enjoyed it.